first diagnosed with it, I was actually told, I don't know. That was kind of the general consensus, was that it was a mystery and they didn't understand it. It was Christmas time and I worked in retail, go to the doctor at Christmas time, you just, push through. And so, about a month later, I did go to the doctor and, I had a respiratory infection and got that all cleared up. But then after all my symptoms were gone, I still kind of just had this little noise in my breathing. I finally went to an emergency room. I'm just like, I can't take this anymore. I cannot breathe. And this ENT doctor did a CT scan that included my airway, and he saw a little shadow. And so that was the first time that anybody had actually seen it.
We see a fair number of patients with her diagnosis, idiopathic laryngotracheal stenosis. Very few physicians have a great deal of experience with it, and it's in a delicate area of the airway around the lower part of the larynx, with challenges with regards to preserving the voice. And so I think a lot of people just end up getting dilated and don't get referred for surgery, or are told the surgery is too high risk. It does require a commitment of the patient, and it's about a 3-hour surgery and usually 5 to 7 days in the hospital.
Kind of started off being like, I needed a procedure to open my airway once a year. And then, it got to be maybe twice a year. And, it just kept getting a shorter and shorter window, of time. And so by the year 2013, I was needing to have my airway dilated every 2 weeks.
She was a record for me. She had told me she had had 60 dilatations of her airway before I met her. In her case, she had an operation many years ago, which unfortunately was very unsuccessful and led to a prolonged hospital stay.
I was seeing an ENT doctor by then that convinced me I needed to let him, basically he just explained it to me like, we're gonna take your airway, cut above the diseased tissue, cut below it, and then sew your airway back together, piece of cake. And it ended up being a 9-hour surgery. And I was in the hospital in an induced coma for a week. And then when they woke me up from that, I actually all in total spent 4 months in the hospital from that because the surgery failed.
And I was told where she's originally from, out on the West Coast, that because of her previous surgery and complications, that she was inoperable and she would have to live like this the rest of her life.
20 years of oral and IV steroids, just not being able to breathe. I obviously stopped any kind of workout or anything like that. I was extremely depressed.
We met by Zoom. I evaluated her case. I thought we might be able to help her, and but we needed to bring her out here, obviously, to really take a good close look at her.
I knew just in the first 5 minutes sitting down with him, I could put my dukes down and he's got me, He's handling this, he's in control, he's confident of what he's doing, and it's just really, really hard to put into words. 20 years of just this load just fell off me.
It was a difficult operation, but it went well. She had no post-operative troubles or complications of note, no infections or problems like she did in her previous operation. And she noticed before she left, about a week after her operation, that she was breathing much better.
It's been 4 months. I would say that this is the strongest that my voice has been in maybe 15 years. I know everybody else just sits around and breathes in and out every day, and you don't really have to think about doing that. But I did a lot, and I don't have to do that anymore at all.